So, hi, my name is Pierre Goaziou. I'm French, and would like to thank you to offering the opportunity to share a bit about the French organization named KIF1A France. And also, I would like to thank you all for singing happy birthday to my Ellie during the lunch break. So, who are we? So, KIF1A France is a local association created in Europe. In France, it's a non-profit organization. Like Salima said a few minutes ago, it's much more easier to create an organization like ours in Europe. It's more or less simple paperwork. And it was created in 2022 by two families having a kid concerned by CAMB. The first family is Audrey, mom of Hugo, and myself and my wife Emmeline, parent of Ellie. We met via the Facebook group named KIF1A Family Support Group, and with the help of KIF1A.org organization. And as far of today, we are in contact with a bit more than 30 families in France, also in Switzerland, mainly in the part of Switzerland where the people are speaking French, and also in Belgium. So why do we create this association? Sorry. As soon as we got the diagnosis for our kid, we realized how little known this illness is in our country. More or less, when I remember the neurologist that gave us the diagnosis said, "I found what your daughter have, but it is the first time I hear about this disease." So, very difficult to hear when you got such bad news. We realize also that there's the medical doctor having knowledge on KIF1A, at least in France, are very, very rare. So you have no one to talk with about the disease you are begin to deal with. And it's very complex to hear, because how can we hope for a treatment or cure if the medical team doesn't even know that the disease exists? We were also aware that there were a very small number of cases in France, but also worldwide. So we know that it's difficult to motivate organizations, biotechs, big company to work on a rare disease. And we discover, that one is an happy news, that the research was active, not in France, not in Europe, but in many countries, in the US, in Australia. So it's very... I lost the slide. Sorry, thank you. It's exceptional for such a rare disease. So we were thinking, what can we do to help what the others are doing in their own country? So after creating the main objective for creating this association in France was to support, gather, inform families about having a kid or multiple kids concerned by CAND, because for most of them, they were aware of CAN just as a name, but didn't have information about what does it mean, what are the main symptoms, what can they expect for the year to come when my kid is 2, 5, 10. Is it going to live a normal life? And that was... So gather everybody in the same room or in a video call or by phone, talking to each other, sharing advice was one of the first and main goal of the association. We also had the objective to support the research, having more knowledge on the disease, on how KIF1A is working, what is happening to a kid that is facing a mutation, and if we can help with the development of treatment for the disease in France, in the European Union, in any country. And like I said, when we got the diagnosis of Ellie, the neurologist said, I don't know what will happen to your kid. I really don't know this disease. It is the first time I hear about KIF1A, or maybe I just have read that name in a book while I was a young student, but I have no information to share with you. So this is something we would like to improve at our level, having the medical team make them more aware of KIF1A, and next time they meet a family, say, I remember KIF1A. KIF1A, this is the list of symptoms, this is the research that exists in Europe, in Australia, in the US. So give a bit of hope and information to families. And for sure, we would like to collaborate with all the organizations around the world. As you may know, we have organizations in the US, in Australia, in Spain, in Italy, Japan. So this is great, and I hope more will appear. I'd like to share a bit about the action we have organized since the creation of the organization. So it's quite basic, but we just created a website. It's helping a lot for the new family receiving a diagnosis to find us. So it's also helping for the medical team, because when they got a diagnosis, they're searching for information to explain the disease to the families. So if they can find some information, either on KIF1A.org website or in ours, that's a start. So they can share more information to the families, and then the family will search by themselves for sure. So we created a website, we have created a WhatsApp group or messenger groups to share main information with the family, share good news, bad news, etc. Wishing happy birthday. And we organize sometimes discussion, usually by video call with the families, so they can ask questions. We can confirm with them, are you interested in doing this study? Did you fill the form? Etc. This is my Ellie. So, and each time we have the opportunity to do it, we are trying to communicate and advocate about KIF1A in our country. Each time we have the opportunity to be invited in a symposium or talk to a conference or to any event, then we usually say yes, just to make KIF1A more known at our level. I like to present KIF1A when we do it in symposium, especially when it's a symposium organized by medical schools, because we have the feeling that medical students of today are the experts of tomorrow. So if they know KIF1A, that will be great. We also had the opportunity to organize a meeting last year in Paris with the help of two hospitals, Hôpital Armand Trousseau and Hôpital Rothschild, in which there is one of the rare medical doctors having knowledge on KIF1A in France, Dr. Alexandra Fenchar. We were also lucky to have Alban Ziegler. I want to share here because I remember Dr. Heikens sharing that it's a small world because she was already in contact with Dylan before working on KIF1A. And in our side, we were lucky to have Alban Ziegler that at this time was, he was previously part of Dr. Chang's team, and now he's back in France, sharing his experience on KIF1A. And when I share his name with our president, Audrey, that you have seen on the first slide, she said, I know this guy. We worked together in the past. So now he is one of the rare experts in KIF1A in France, and she is the mom of a KIF1A kid. So a small world. During this event, we tried to collect as many blood samples that we could to extract the DNA and try to send it to Boston. We had a misadventure on that one because we collected almost 15 samples. Part of it was new blood collected at the event, and part of it was we organized the transfer of blood sample from other hospitals in the country to Paris. Then the samples were analyzed again, then shipped to the US. And here is the misadventure. FedEx lost the package. So it's a bad news, but we are in the process of retrying, and we will do it again as many times as it takes so the package reach Boston. And for sure, we are fundraising to finance our actions. We have simple plan for the future. We are trying to improve the care of KIF1A patient by sharing more information, like I said, with the medical team, with the families, with the physiotherapists, so they can, the more they know, the better they help the patient. We are trying also to develop the participation of European countries in the research. I have here, it's my personal feeling, but I have the feeling that in Europe, you know, the health system is very different. Usually, the objective is to try to take care of everybody. So for caring about on patients, it's okay, but it's not so good on the innovation side. I'm pretty sure 80 or 90% of the new drugs discovered are done in the US or but usually not in Europe. So we'd like to change that. And we are also trying to find motivated experts of medical doctor to help us bring or create new treatment in Europe and to make them available to everybody. Thank you.